Emeritus Professor Issy Segal, known fondly to many others as Issy, was born in Johannesburg on the 7th of July, 1933. He was one of 8 children. After graduating from the University of the Witwatersrand with an MBBCH in 1962, he worked in Soweto as a general practitioner for 7 years. It was a time in South Africa where very few people from his background chose to work among the needy in Soweto. It was a decision which changed the direction of his life and his work. While treating his patients, he noticed trends related to their digestive system. It was both in terms of disorders they had and those that didn't. He decided to pursue his career by specializing in gastroenterology. He went on to establish the first gastroenterology unit at the then Baragwanath Hospital, Bara as it was then. This was in 1975, people living in Soweto. He led the research with a team that included international researchers like Dr. Alice Walker of the Wits School of Pathology. They looked at cancer of the esophagus, which had gone from a rare disease among black South Africans to becoming its commonest cancer. In 1984, they published a seminal piece of work which focused on the sociological contributory risk factors in the black urban population of Soweto. It had been previously noted that smoking tobacco, in particular pipe tobacco, was a risk factor. Their research did reinforce this, and it showed that the consumption of traditional sorghum beer was among the major risk factors. Other research in Dr. Segal's work in the 1980s revealed black South African men were diagnosed with esophageal cancer a decade earlier than their white counterparts, and who lived twice as long after diagnosis. He also researched the connection between appendicitis and the level of dietary fiber intake, hepatocellular carcinoma or cancer that starts in the liver, on how it relates to oral iron overload, as well as the low incidence of colonic polyps in the South African black population. Besides working with the likes of Walker, he also published his research in collaboration with leading British surgeon Dennis Burkitt. Together, they pioneered in showing how high-fiber diets help protect against colon cancer. Prof. Segal's innovative research work was not only to explore the differences in gastroenterological disease in black and white South Africans, it was also to ensure that these conditions were appropriately and successfully managed in the underserved population of Soweto and beyond. Wits recognized his contributions to the field by promoting him to associate professor in 1981 and subsequently to full professorship in 1991. In 1992, Prof. Segal founded the Africa Institute of Digestive Disease with training centers at 2 of Wits' teaching hospitals, namely Baragwanath and the then Johannesburg Gen. His aim was to promote gastroenterological education, training and research in South, Central and Northern Africa. More importantly, however, was the Institute's aim to ameliorate gastrointestinal disease in Africa, improve standards of healthcare and education, and to inspire confidence that Africa can contribute to finding solutions to the continent's health problems. This venture was conducted without government support. Prof. Segal said that the ideals and philosophy of the African Institute go far beyond the frontiers of gastroenterology and endoscopy. It gives an opportunity to break down artificial borders and cultural barriers and to pool Africa's rich resources of talented people to enhance the level of care given to our patients. He served on the World Gastroenterology Organization's Education and Training Committee for Africa and the Middle East. He was also on the Scientific Advisory Committee for the World Congress of Gastroenterology in 1998. His peers recognized his contribution, and he was made president of the South African Gastroenterological Society, SAGES, from 1987 to 1988, and honorary life president in 2001. The Faculty of Health Sciences presented him with an Exceptional Service Medal in 1998. In 2009, he was named a Master of the World Gastroenterology Organization, the highest honor the organization can bestow on a member for outstanding dedication to the mission of the organization and to those who have achieved distinction in areas of such scholarly endeavor. Recipients may use the title Master of the WGO as letters MWGO in conjunction with their name. Issy Segal has not let his octogenarian status affect his output. At 86, and as of today turning 87, he's still a force to be reckoned with. His extensive publication includes a very personal one, a 132-page volume published in 2016 titled The Diary of a Slum Boy, Selected Poems. He is referred to as Snapshots of Soweto and Baragwanath Hospital, which reinforced for him the poverty, the sadness, and the despair that is the lot of most of the inhabitants of Soweto. In light of his extraordinary achievements, it is therefore befitting that the University of the Witwatersrand, Johannesburg, bestow an honorary doctorate degree on Issy Segal.